Processing. Hello, everyone. My name is Abdel. Welcome back to our channel, the Free Thinkers channel, where we discuss all the different events going on around the world. Today, we'll be discussing uh, COVID COVID 19 vaccines. I'm with Keen Show.
How's it going, everybody? Thank you for joining us today. All right, Abdel, let's just get straight right into it.
Yeah, so we've been.
COVID-19
Oh,
vaccines.
so hold on, I want to ask you a question. This I didn't plan to ask you before. It's been a while. We haven't talked about the vaccine. The vaccine been out for a while. We are both professional. We are both in the we both pharmacists, and we work in the hospital. And so that's why we finally decided. You know what? It's time for us to discuss on the vaccines and make sure we clear up some of the misconception that might be out there.
Yep,
Right.
yep,
Today we're
yep.
specifically going to talk about the Moderna vaccine, though. Hopefully we'll do another video about the Pfizer vaccine and the AstraZeneca vaccine. The AstraZeneca vaccine, the one from Oxford, from England. They, I think they're expecting to be FDA approved as well soon in the United States. So we'll talk about those in a different video.
Cool, cool, cool. So, how should we go about this? Let's just get straight right into it. What are vaccines? If you would describe a vaccine, how would you describe it, Abdel?
Basically, vaccine to me, if I want to put it in a layman term, is they help your body get they help prepare your body to fight a disease or to fight an infection. Basically, it's more like you learning the the defense or the attack of a military of an opposing military, and you preparing yourself based on that, so you can fight. You can be ready and defend yourself when they come along.
Okay, so it's like teaching your body martial arts, huh?
Yes, teaching your body martial art, knowing every move of the person you're gonna fight. Like if
One way I've
it's
one way it's been described to me, or analogy I've seen someone use before is it's like maybe there's people breaking into houses in your neighborhood. So, and maybe the guy that breaks into the house always uses the back door. So then, as a precaution, you go and reinforce your back door with an extra deadbolt and like an extra security door. And that way, it's harder for that person to break in.
eh,
Maybe the person could still break in eventually if they tried hard enough, but maybe by then you'd be able to call 911, or you'd be able to get that person to fight the person off, or prevent the person from breaking in and doing the damage that they're intending to do. So that's to put it in the most basic
yeah,
layman.
true. It's a cheat sheet. Or if maybe for people who like to, I mean, it's like you knowing all the answers on an
Ah,
exam that you're about to take,
so do
so
you
you can
think?
get
Do you think? What do you in vaccines in general, and just the history of vaccines? Overall, are they safe? Are they effective?
Yeah, they're pretty effective. They're pretty safe and pretty effective. And a good example of that would be the polio vaccine.
Mm-hmm.
Or in the United States, something that might hit home with the measles vaccine. Measles basically was non-existent. It has become non-existent in the United States until very recently, where we have a growing movement of the anti-vaxxer who do not want to take vaccine, and that in that case that led to few measles outbreak in certain areas. But vaccine in general have been very effective in preventing people from getting sick from a virus or a bacteria, or from getting sick from a virus.
Mm.
It's been
That's right,
pretty.
and I mean, and it's played for example, like in Africa, it's played a big role in
I can hear you. Oh wow, we lost Keen Show. I think we should have put our doctor titles because we're both pharmacists here. Anyways, we lost him for a minute while we're waiting for him to come back. So we were talking about the Moderna, the different type of vaccine, the efficacy of vaccine over there, if they're also safe. Yes, vaccine in general are safe and effective. And I gave an example of the polio vaccine, how that has helped a lot in Africa, where in my country, for instance, polio is almost non-existent. Is almost non-existent now. I think the WHO declared Nigeria polio-free a year or two ago, if I remember correctly, the exact time. So it does work. Vaccine does work, and they're usually safe. When it comes to the COVID vaccine, there is currently two that have been approved in the United States. So there is the Moderna vaccine and the Pfizer vaccine. Today we'll focus our interest on the Moderna vaccine. There is also the AstraZeneca vaccine that has been approved in England. There is also the vaccine that has been approved in Russia. But the AstraZeneca vaccine will is expecting to be approved in the United States as well. We will be discussing those in the near future. When it comes to efficacy of the Moderna vaccine, the Moderna vaccine based on the COV trial. So the COV trial is the study that I believe brought it to the market, led to the EUA from the FDA. That in that study, the COV study, it has been shown the Moderna vaccine has been shown to be 94.1% effective in preventing COVID-19 illness. So that's a key. That is very important. Are you back with this? I still can't hear you. Now I can't hear you at all. Nope. Nope. Sorry, technical difficulties going on right now. I can see you, but I can't hear you. Oh, keep going. Okay, okay, okay. So, as I was saying earlier, the COVID-19 vaccine, the Moderna COVID-19 vaccine was brought, was a granted emergency use authorization by the FDA based on the COVE study. COV, you can Google it and you can read the trial for yourself. Basically, it stated that the vaccine is 94.1% effective in preventing COVID illnesses. This is mainly preventing you. It doesn't is this preventing you from getting sick from the COVID-19 virus, meaning you getting all the body ache or the headache or the fever or and not being able to go to work. That is what is preventing the efficacy. The study did not look at COVID-19 infection prevention, so we do not know if the vaccine prevents you from actually getting infected. If you look at previous vaccines, if I want to give you a good example, would be the flu vaccine. This is pretty similar to the flu vaccine, whereas the flu vaccine does not prevent you, based on the CDC, it doesn't prevent you from getting the flu. It just prevents you from getting sick from the flu, which will be beneficial here. Some of the benefit of this virus is it's been theorized that it can prevent infection. Although it was not tested in the study, it has been theorized that it can prevent infection because it will decrease the symptoms of the illness. Based on the CDC recommendation and some of the infectious disease gurus out there, is your risk of infecting others is high when you are coughing and having those symptoms, especially the coughing part. So if you can decrease those, you are less likely to infect others. This will lead to the decrease infection. This is where you can get the benefit of it. However, that has not been tested. It's just theory. The only thing that has been tested so far is for sure the vaccine will prevent you from getting severely ill or getting ill from the COVID-19. What type of vaccine is the Moderna vaccine? Is an mRNA vaccine. What does that entail exactly? I don't know if I'm trying not to get too technical here, but basically, it's just a system that the mRNA vaccine is part of the every cell in our body has a DNA, mRNA. Oh, that's how we are made. We made so mRNA usually is a messenger in our body to that lead to the production of a protein. The mRNA vaccine use the that messenger in the that is in the virus. They use the mRNA, introduce it in our system, in our body, and produce the protein that our body will react to when we get infected from the virus. This lead to our body being prepared and be ready to fight the vaccine when it occur. Based on what I've heard so far, the mRNA itself will disappear short within the will disappear after being injected, so you don't have that in your body for a long time. And this also does not give you COVID-19. This is not in we don't this is not you getting quarantine positive from the you won't test positive just because you got the you got the vaccine. So it's slightly different from other vaccine. In other vaccine is usually, or at least previous vaccine that have been used, an example would be the flu vaccine, usually a weakened or dead virus that is given to us, but we can still respond to the protein so that we can prepare and be ready for the vaccine and prepare and be ready to fight it when we actually get infected by it. So, I mean, I hope this give you a slight understanding of how the vaccine itself works. If you have any question, please send us a message. If there is things you want us to fix, or there's things that we I have mm, you believe are not entirely correct, send us a message, and we'll be able to address it on our next video. So this vaccine, for the both vaccines that have been approved in the United States, are two-dose vaccine. So you have to get one. You get the first time. You get one, and you get one now, and you have to get another dose 28 days after. That's for the Moderna. For the Pfizer vaccine, that one is 21 days apart. The people that the Moderna vaccine has been approved for are people who are 18 years and older. They did not include pregnant women in the study, and they did not include children either. So based on the study, they only look at they follow up the patient based on the study where we are right now. They follow up the patient for a median day of 63 days, so about 2 months. So right now we only know for sure that it's effective for 2 months. The study is still going on, so we'll have more data being released in the near term. So that will tell us exactly how much more uh, how long you are actually protected once you get the vaccine, and if you need to be revaccinated and stuff. So those are the key things that we need to keep in mind. So this vaccine itself has adverse effect. This is similar to every medication. There's always a side effect. So one of the side effects that you usually get from the vaccine is the pain at the site of injection. So that is what it has been reported as most common adverse effect. So the pain at the site of injection. You back with this now?
Yes, can you hear me?
I can hear you now.
I'm not sure what in the all the conspiracy theories. They hacked my laptop. They don't want to hear the truth. Like my laptop just died. I noticed that it just went off. It went dead, and yeah. But
I don't know
sorry,
what's wrong. You cannot blame nobody. I don't know what happened to your computer. But
it just
anyways, so I
died, and it's plugged in. It's plugged in, and it died. I don't understand what's going on.
So while you were having technical difficulties, I've actually talked about the dosing. I talked about the type of vaccine and how it
Okay.
works. I tried my best to be to explain it in layman terms. I talked about the efficacy and what it looked at, what is actually preventing and what is not preventing based on the study.
Okay.
Uh, what else did I talk about? Yeah, I think that's all I talked about. I talked about the efficacy. I talked about how it's compared to the flu vaccine. I forgot to mention that the COVID-19 vaccine at this time has been shown to be more effective than the flu vaccine. Now, the study itself, in the comment, they mentioned that this might be high at this time because the time they were doing the study, a lot of people were wearing masks, a lot of people were put a social distancing that may have affected the the result of the study.
So I have a question. So when you're comparing the efficacy of the COVID-19 vaccine to the flu vaccine, are we saying is the if you get the COVID-19 vaccine, you don't need a flu vaccine?
No, 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 not even close. I'm not talking about that.
So
I'm not saying they don't do the same thing. If you get no,
I just want to clarify so we're not confusing
no.
people.
So the COVID vaccine will not protect you against the flu, and the flu vaccine will not protect you against the COVID-19. You need to get both.
Okay.
Now, what I was comparing the efficacy. Usually, the flu vaccine is about 59%. Once you get the flu vaccine, the likelihood of you getting sick from the flu is about 59%. Of you not getting sick from from the flu is about 59%. Meanwhile, if you get the COVID-19 vaccine, the Moderna one, the likelihood of you not getting sick from COVID-19 is 94.1% is what I was trying to say. So
So
yeah, so I wasn't comparing the
still,
efficacy.
but you could still get COVID if you get the
The-
vaccine.
Well, the study itself did not look at if you they didn't look at the vaccine preventing you from getting COVID. So if you see Dr. Fauci speaking, for instance, you will hear that you will notice that he keeps saying you will still need to be wearing your mask, you will still need to be doing distancing. The main thing that this vaccine has looked at, this study has looked at, is the prevention of illness. So once you get the flu, there is a lot of people. Sorry, there's a lot of people who get COVID-19 and don't get sick. This vaccine is only look at people who get this vaccine is only looking at the prevention of COVID-19 illness. Like once you get the COVID-19, do you get sick? Like that's mainly what the study was actually looking at, and that is what the 94.1% efficacy comes from. So I was
Oh,
actually at the adverse effect. I was talking about the adverse effect earlier. This the most common adverse effect was the pain at the site of injection. That is what has been reported. Usually, you will usually receive it here or here. You will feel the pain. Some people have reported pain in the armpit or in the lymph node. Those were not mainly common. Were not that reported in the study. The main one that were reported is the pain at the injection site. So those are the local adverse effect. The systemic adverse effect, meaning in your body, the one that has been reported will be fatigue, chills, and headache. Fever was not common. Fever was also reported, but was not that common. The most common was headache, fatigue and headache. Chills was also common. And myalgia. Myalgia just means pain all over your body. There was something that was important to mention. The Bell palsy was also reported. There were 3 cases of Bell palsy
the vaccine.
the in the vaccine arm. So in people who actually received the vaccine, and there was 1 case of Bell palsy in the patient who just received the placebo. In this case, the placebo is just like is a substance. Usually, it can be glucose or a normal saline. I don't know what they actually put in their placebo in this case, but it's not the active drug. So in this case, in that placebo arm, there is one patient who also developed Bell palsy. Bell palsy is partial paralysis of your face, I believe. And I've noticed there were videos of a nurse who have reported that as well. So the number of people developing this were not significant enough to actually determine if it was really caused by the vaccine or if it was just an error or if it occurred
Well,
by
I
chance.
think one thing I did see was that they said the incidence of Bell's palsy that occurred in the vaccine arms of the what's did not exceed the incidences of Bell's palsy in the general population. For instance, I think the incidence of Bell's palsy in the general population is about 15 for every 100,000 people. So
Okay.
that's one of the explanations that was given in regards to, because for instance, just like you said, it was three instances of Bell's palsy in the Moderna vaccine arm and one
Yeah.
in the placebo. For the Pfizer vaccine, I believe it was four. There was four
Oh, I
instances.
did. So I didn't know there was any Bell palsy report in the Pfizer vaccine. That I can say.
Oh no, I did read that there was four in the Pfizer vaccine arm. There was zero in the vaccine arm.
You
Uh,
you mean in the placebo arm when it comes
in
to
the,
the
in
Pfizer
the in
study?
the placebo arm, sorry, zero in the placebo arm and four cases. But the explanation, like I said, was given in both cases was that it does not exceed the general incidences of Bell's palsy you will see in the general population, which is about 15. I think they said 15 to 30 cases for every 100,000 people.
Mm,
Um, but I guess it's also important to note that, I mean, most, whether it's vaccines or medications, there's always going to be different reactions that people experience.
right.
Uh, there's always going to be adverse effects because science is not a perfect, I mean, medicine is not a perfect science. Um, whether it's Tylenol or Benadryl or
You always
there's
another
always
thing
going
they
to be.
mentioned. Another thing to mention here is also allergic reaction. I
Hmm.
don't in the study, if I remember correctly, they were not really they didn't have a significant number of people having allergic reaction to the vaccine.
Mm.
So they didn't think it was major. However, I know since it has been rolled out, we've reported people have reported fanning. Um, fanning is one of them that's common. Nothing major when it comes to like really. Fanning is not necessarily an allergic reaction, but allergic reactions such as like severe rash or inability to breathe and so on. So I really haven't seen any of those in real practice either. So these vaccines are actually very safe to receive or to take. I have already taken the vaccine. Oh, there is one thing I need to mention. I do have well, this is full disclosure. I do have some stock in the Moderna, some Moderna company stock, but my recommendation, um, my expertise in this area is on the studies and nothing else, and my experience as well.
This is
So
a full disclosure that is coming that you did not disclose to your partner in this video.
I already told you that before I started, but
You
I
are
forgot to
fully.
mention it when we started the video here. So that's why I'm saying it.
I do not have any stocks or any special interests. I am for everybody, and I'm also for nobody.
Yeah, for everybody.
These are the words of a great president. But yeah, I mean, thank you for your deep explanation to the Moderna vaccine. And you know, of course,
It's
I think it's understandable if people feel a little bit hesitant about taking the vaccine. Some people cite for instance, the time it took, but I think it's also important for people to know that even though it was done faster than usual, and they say that all the time in the media. They say there are no shortcuts taken, and some people might wonder like, how can you do it faster than usual, but there are no shortcuts taken? What they and I think that one of the explanations for that is that there are different phases to these trials and things like that, and usually a phase goes one after the other. But in this case, it's almost like they were not necessarily waiting for one phase to be completed before they moved on to the next phase. It was just more of
uh,
everything being fast tracked because we are in a
so
pandemic.
one of so if I understand the process correctly, one of the reasons why vaccine usually takes longer is because sometimes it's a little at least previously was the difficulty when it comes to determine the protein that will be that will like
The
the
sequence,
antigen that we need to that the body need to respond to so they can prepare. So, but in this case, it was a lot easier because they were using mRNA. By January, they already did the full decoding of the full sequence of the vaccine, no, the virus has been decoded. So everybody knew all the different um how can I put this? The I want to say the mRNA sequence of the virus has been decoded, so we know all how to we know we already
Like,
knew how to
a
make the vaccine
significant
at that
amount
time.
of the research has already been done. A significant amount of research has been done.
So
It
it was
wasn't much.
already so the thing is we already knew the virus very well at that point when it comes to the RNA the DNA or the mRNA sequence. The next thing is the technology itself was already present because that is something that they've tried to use when it comes to Ebola. So they just applied the technology. There is also another thing that usually lead to delay in developing vaccine. Funding. Funding was also another issue, but because this virus was everybody's concerned, everybody was worried about it. Funding was not an issue, so that also helped the fact that everybody has money. Everybody put money down. I mean, money was available for people to do the research. Company were not worried about losing money because they felt like they would be able to recoup their money. So everybody started doing research on it. So that is another thing that helped as well. Also, in the United States, at least, President Trump did do something right when it comes to fast tracking some of the process with the Operation Warp Speed. So that is also something that was beneficial. But I mean, I don't think there is anything. We have the studies, we have the data to back everything up. So there is nothing to really fear when it comes to the vaccine and the speed of the production. So I have no problem with that. It is important to note that also that this study is still going on. It's not done yet. It will be continuing for the next 1 year and a half. They plan for a full 2 years follow up for those patients that were initially included. So we'll be having more data as time goes on and see how effective the vaccine really is. So there is more information that will be coming up.
Awesome, awesome, awesome. Well, I think you for the most part, but me as well, due to my technical difficulties. I think
Difficult.
I think we did a decent job in talking about vaccines in general and COVID-19 vaccines specifically the Moderna
More than
vaccine.
a vaccine, correct?
And we just want to encourage people. Don't always go for all the conspiracies. I mean, there's a lot of conspiracies out there, a lot of fake news, a lot of just unverified stories. Just be careful of where you get your sources from. As Abdel mentioned, we're both pharmacists. We're not trying to say we're know-it-alls, but we are pretty knowledgeable when
True.
it comes to medications or the healthcare field in general. So just be careful where you get information from. And the CDC website is there, the World Health Organization website is there, the FDA website is there. Those places have credible information, and people shouldn't necessarily treat vaccines like it's something different and it's completely total. I mean, the same processes that vaccines go through is kind of the same processes that your everyday medications like Tylenol and your birth control. If you trust people with your birth control, with your Viagra, with your blood pressure medications,
It's
you
the same.
trust these companies to make those things, and you trust doctors with surgeries and things like that. There are a lot of conspiracies that people think, oh, these vaccines are out to just kill people or put microchips in them, or they're demonic and things like that. It's just completely bizarre stuff. I mean, if you think that about vaccines alone, without thinking about that about other medications or other things that you ingest that are produced by people you don't necessarily know on a one-to-one basis, it's just pretty extreme. So that's
Well,
like my final thought for today. Abdel?
if you do have any of those conspiracy theory you want us to address, please let us know. It's always a pleasure for us to dive into those topics and discuss it, especially since it's kind of our area of expertise. So we'll expect to hear from you guys, and thank you so much for tuning in today.
All right, everyone. Have a good night and keep thinking freely.